Behavioral health is a broad term that covers the connection between our behaviors and the health of our mind, body, and spirit. It goes beyond just mental health, including how habits, actions, and choices impact our overall well-being. For example, how we manage stress, our sleep patterns, and even our eating habits all play a role in behavioral health. Understanding this concept is the first step toward making positive changes in our lives. In this video, we'll explore the many aspects of behavioral health, why it matters, and how it affects every part of our daily routine. Many people use the terms mental health and behavioral health interchangeably, but there are important differences. Mental health focuses on emotional, psychological, and social well-being, while behavioral health includes mental health and the ways our habits and actions influence our overall health. For instance, substance use, eating patterns, and exercise routines are all part of behavioral health. Recognizing this distinction helps us address a wider range of issues and supports a more holistic approach to wellness. Behavioral health matters because it influences every aspect of our lives, from our relationships to our ability to work and enjoy life. When behavioral health is neglected, it can lead to problems like anxiety, depression, substance abuse, and even physical illnesses. By paying attention to our behaviors and making healthy choices, we can improve our quality of life and build resilience against life's challenges. This is why understanding and supporting behavioral health is so important for individuals and communities. There are many common behavioral health issues that people face, such as anxiety disorders, depression, substance use disorders, and eating disorders. These issues can affect anyone regardless of age or background. Recognizing the signs early can make a big difference in getting the right support and treatment. It's important to remember that these challenges are not a sign of weakness, but rather a signal that help may be needed. Addressing these issues can lead to a healthier, more fulfilling life. Daily habits have a powerful impact on behavioral health. Simple routines like getting enough sleep, eating nutritious foods, and staying physically active can support both our mental and physical well-being. On the other hand, unhealthy habits such as excessive screen time, poor diet, or lack of exercise can contribute to behavioral health problems. By becoming more aware of our habits, we can make small changes that add up to big improvements over time. Stress is a normal part of life, but how we cope with it can make a big difference in our behavioral health. Healthy coping strategies include talking with friends, practicing relaxation techniques, and engaging in hobbies. Unhealthy coping, like substance use or withdrawing from others, can worsen behavioral health issues. Learning to manage stress in positive ways is a key part of maintaining overall wellness. Sleep is often overlooked, but it plays a crucial role in behavioral health. Poor sleep can lead to irritability, difficulty concentrating, and increased risk for mental health problems. Establishing a regular sleep schedule and creating a restful environment can help improve both mood and energy levels. Good sleep hygiene is a simple yet effective way to support behavioral health. What we eat doesn't just affect our bodies, it also impacts our minds. A balanced diet rich in fruits, vegetables, whole grains, and lean proteins can boost mood and energy. On the other hand, diets high in sugar and processed foods may contribute to mood swings and fatigue. Paying attention to nutrition is a key part of supporting behavioral health. Regular physical activity is one of the most effective ways to support behavioral health. Exercise releases endorphins, which are natural mood boosters. It also helps reduce stress, improve sleep, and increase self-esteem. Whether it's walking, dancing, or playing sports, finding an activity you enjoy can make it easier to stay active and support your overall well-being. Humans are social creatures, and our relationships play a big role in behavioral health. Strong social connections can provide support during tough times and add joy to our lives. On the other hand, isolation can increase the risk of behavioral health issues. Making time for friends, family, and community activities can help build a strong support network. Substance use, including alcohol, tobacco, and drugs, can have a major impact on behavioral health. While some people use substances to cope with stress or emotions, this can lead to dependence and worsen mental health issues. Seeking help for substance use is a sign of strength, and there are many resources available to support recovery and healthier choices. Recognizing the signs of behavioral health issues is the first step toward getting help. Changes in mood, sleep, appetite, or energy can all be warning signs. If you or someone you know is struggling, reaching out to a healthcare provider or counselor can make a big difference. Early intervention can prevent problems from getting worse and lead to better outcomes. It's important to remember that seeking help for behavioral health concerns is a sign of strength, not weakness. There are many professionals such as therapists, counselors, and doctors who can provide support and guidance. Reaching out can feel difficult, but it's a crucial step toward healing and growth. You're not alone, and help is available. Therapy and counseling are valuable tools for improving behavioral health. These services provide a safe space to talk about challenges, learn coping skills, and set goals for positive change. Different types of therapy, such as cognitive behavioral therapy or group counseling, can be tailored to individual needs. Working with a professional can help you develop strategies for managing stress and building resilience. In some cases, medication may be part of a behavioral health treatment plan. Medications can help manage symptoms of depression, anxiety, or other conditions, especially when combined with therapy and lifestyle changes. It's important to work closely with a healthcare provider to find the right treatment and monitor progress. Every person's needs are unique, and treatment should be personalized. Self-care is an essential part of maintaining behavioral health. This includes activities that help you relax, recharge, and take care of your body and mind. Examples include reading, spending time in nature, practicing mindfulness, or enjoying a hobby. Making time for self-care isn't selfish, it's necessary for overall well-being. Mindfulness and meditation are powerful practices for supporting behavioral health. These techniques help you focus on the present moment, reduce stress, and improve emotional regulation. Even a few minutes a day can make a noticeable difference in mood and clarity. There are many ways to practice, from guided meditations to simple breathing exercises. Resilience is the ability to bounce back from challenges and setbacks. Building resilience involves developing coping skills, maintaining a positive outlook, and seeking support when needed. Life can be unpredictable, but with resilience, we can handle stress and adapt to change more effectively. It's a skill that can be learned and strengthened over time. Family can play a significant role in behavioral health. Supportive family relationships provide a foundation for emotional security and help during difficult times. Open communication and understanding within families can make it easier to address behavioral health concerns and seek help when needed. Families can also learn together about healthy habits and coping strategies. Communities offer many resources to support behavioral health, such as support groups, hotlines, and wellness programs. These resources can provide information, connection, and practical help for those facing challenges. Getting involved in community activities can also reduce isolation and build a sense of belonging, which is important for overall well-being. Workplace is another important setting for behavioral health. Employers can support employees by offering wellness programs, flexible schedules, and mental health resources. A healthy work environment reduces stress and increases productivity. Employees can also take steps to manage stress, set boundaries, and seek support when needed. Technology can be both helpful and challenging for behavioral health. On one hand, apps and online resources make it easier to access support and information. On the other hand, too much screen time or social media use can increase stress and anxiety. Finding a healthy balance is key to using technology as a tool for wellness. Culture shapes how we view and address behavioral health. Different cultures may have unique beliefs, traditions, and approaches to wellness. Understanding and respecting these differences can help create more effective and inclusive support systems. It's important to seek culturally sensitive care and resources when needed. Prevention is a key part of behavioral health. This includes building healthy habits early, teaching coping skills, and creating supportive environments at home, school, and work. Prevention efforts can reduce the risk of developing behavioral health issues and promote lifelong wellness. Trauma can have a lasting impact on behavioral health. Experiences such as abuse, loss, or accidents can affect how we think, feel, and behave. Healing from trauma often requires professional support and time. It's important to recognize the effects of trauma and seek help to process and recover. Children's behavioral health is just as important as adults. Early experiences, family environment, and school life all influence a child's well-being. Teaching children healthy coping skills and providing support can help them grow into resilient adults. Early intervention is especially important for children showing signs of behavioral health concerns. Behavioral health is important at every stage of life, including older adulthood. Aging can bring unique challenges such as loss, isolation, or health issues. Staying socially connected, active, and engaged can support behavioral health in older adults. Communities and families can play a big role in providing support and resources. Stigma around behavioral health can prevent people from seeking help. It's important to talk openly about these issues and challenge negative stereotypes. Education and awareness can help reduce stigma and encourage more people to reach out for support. Everyone deserves understanding and compassion when it comes to behavioral health. The field of behavioral health is always evolving, with new research, treatments, and technologies emerging. Advances in telehealth, digital tools, and personalized care are making support more accessible than ever. Staying informed about these changes can help individuals and families make the best choices for their well-being. Summary: behavioral health is about the connection between our actions, habits, and overall well-being. By understanding its importance, recognizing the signs, and seeking support when needed, we can all take steps toward a healthier, more fulfilling life. Remember, behavioral health is a journey, and every positive change counts. Thank you for joining us on this exploration of behavioral health.